A 40-year-old woman comes to the physician with a 1-week history of a cough. She says she has reason to believe she may have lung cancer and asks the physician to order a chest x-ray so she can be sure. The patient's record shows she has visited doctors in the past few years with similar concerns. She has no family history of cancer. The patient seems anxious, but physical examination is otherwise unremarkable. Which of the following is the best choice for the physician to say at this time? Choice A, can you tell me more about what the other physicians have told you about your cough? Choice B, do you have a history of psychiatric disease? Choice C, I'll order the x-ray for you, but you may have to pay out of pocket for it. Choice D, why do you think you might have cancer? Or choice E, is there something else bothering you which might be causing your cough? I'll wait 5 seconds and answer the question. Now, I know always with the case with ethics questions, there's always going to be people who don't see the point because people feel like these are almost common sense. But some people actually do get confused about these, so let's just check off the box as always. So obviously the consistent message in this question is that she most likely doesn't really have anything wrong with her. She's going to a bunch of different doctors, doesn't really have any notable symptoms. Obviously, as always, the principle you stick to is open-ended questions, patient-centered care, and try to validate the patient's emotions and understand your perspective. So of course, choice D, why do you think you might have cancer, is the correct answer. Now, let's just run through the wrong answer choices here, because I think sometimes people who struggle with this stuff, it's more that you have a hard time eliminating the other answer choices because you feel like they might sound reasonable. Well, right off the bat, we obviously just cross off choice B, okay? Do you have history of psychiatric disease? This is just an obviously judgmental thing to be saying. And really, if you apply a bit of sense, even if you are 100% sure that they had a psychiatric disease, this is just not a wise way of saying this. You could possibly say this to a patient you already built a rapport with, but certainly not one who is anxious and looking for a doctor to at least empathize with them. Choice C is also obviously wrong, because not only is it futile treatment that might reinforce her anxiety, but you're also exposing the patient unnecessarily to a bunch of radiation, which is just obviously a bad idea. So looking at the ones that aren't just blatantly wrong, choice A, can you tell me more about what other physicians have told you about your cough? Now, of course, that might be useful information for you, the physician, but like I said, you want to prioritize the patient's beliefs and their concerns. Jumping straight into asking this kind of question just seems like you're not really paying attention to the patient. And it potentially has this subtle implication that you're saying that she's not really listening to what other physicians have told her. And choice E, is there something else bothering you which might be causing your cough? Again, this is something you might potentially ask later in the patient interview, but you're just prioritizing the wrong things here, right? And once again, there's kind of this subtle implication from this answer choice that the patient is not being honest about what it is that's bothering them. So bring it back. I mean, you just got to stick to your principles with a lot of these ethics questions. You got to ask open questions. You got to be very patient-centric. I think for those of you who get these kinds of questions wrong, there's not a lot of advice you can be given other than that you kind of have to do a bunch of these questions and get a feel for some very specific and cliche wording that the exam likes to throw at you. And I know some of you think these questions are dumb because they don't feel like they exist in the real world a lot of the time, but it is what it is. It's part of the exam. I hope you found this video helpful. I'll see you in the next one.